all true healing is self-healing. I want to teach them what you can do to handle most, usual, everyday, acute conditions. And you don't have to immediately run off to an ER and spend hundreds of thousands of dollars unnecessarily. And the more tools you have in your armamentarium to be able to help yourself and keep yourself out of the ER or necessary hospitalizations, the better. It's much more cost-effective, holistic, natural approaches to healing.
What are you most excited about at the moment in the world of homeopathy or whatever work that you're doing? Like, have you got some things on the horizon that you're working on? But what's really getting you excited at the moment in your work?
Well, Kim and I are working together on global natural health solutions, which is our...
Today's guest is Dr. Mitchell Fleisher, who you may have seen in the documentary Introducing Homeopathy. Now, Dr. Mitch literally has more letters after his name from all of his certifications than he actually has in his name. And I'm going to have to read his bio out to you because it is absolutely astounding. So Dr. Mitch Fleisher is a double board certified licensed family physician specializing in anti-aging, regenerative medicine, peptide therapy, exosome and stem cell therapy, advanced musculoskeletal injection therapy, constitutional homeopathy, nutritional and botanical medicine, IV therapy, chelation and detoxification therapy, bioxydative therapy, and bioidentical biomimetic hormone replacement therapy, with over 40 years experience practicing the gentler art and science of integrative medicine. He is the originator of Joint Regeneration Therapy, a safe, natural, non-surgical alternative joint repairing therapy that is anti-inflammatory, tissue restorative, medicinal peptide, hormonal, homeopathic, and oxygen ozone injection technique designed for the treatment of acute and chronic musculoskeletal pain, made even more effective with stem wave therapy. Now, I just have to insert in here as well that Dr. Fleisher does teach a master course to other medical practitioners on how to do this. So if you are anywhere in the world and you want your doctor to learn how to use joint regeneration therapy, please get in touch with Dr. Fleisher. Dr. Fleisher has served as an active member of the clinical faculty of the National Center for Homeopathy, a clinical instructor for the University of Virginia Health Sciences Center, and at the Medical College of Virginia, where he has taught homeopathy in the introductory complementary medicine programs, and has and continues to lecture throughout the U.S. and internationally on classical homeopathy and nutritional therapy to both medical professionals and the lay public. Dr. Fleisher has served on the faculty of the New England School of Homeopathy and as clinical preceptor for the esteemed Hahnemannian College of Homeopathy. He's a graduate of both of these homeopathic institutions as well. He attended Stanford University School of Medicine, during which time he began his homeopathic studies in 1975. He's a former assistant clinical professor of family medicine at the Medical College of Virginia and former associate medical director of the MCV Blackstone Family Practice Residency Training Program, of which he is a graduate. Whew. He is also a former assistant clinical professor of family medicine at the University of Virginia Health Sciences Center and is a fellow of the American Academy of Family Physicians, diplomat of the American Board of Family Medicine, diplomat of the American Board of Homeotherapeutics, diplomat candidate of the American Board of Chelation Therapy, and a fellow of Seed Scientific Research and Performance. He serves as a professional integrative medicine consultant to several major healthcare institutions and corporations, as an organizer and participant in integrative medicine clinical research. As the medical director of a highly regarded nutritional company involved in the research and development of high-quality nutraceutical supplements, as an editorial advisor for several published texts on homeopathy and nutritional therapy, as a member of the editorial board of the American Journal of Homeopathic Medicine, and contributes articles on homeopathic medicine, nutritional therapy, peptide therapy, chelation therapy, and integrative complementary alternative medicine to medical journals and popular magazines. He is the author of Alternative DrMCare Natural Medical Self-Care Protocols, designed to help people treat themselves with natural therapies, which may be accessed at alternative.drmcare.com. And I just have to insert in here that I am also an affiliate for that. So if you do sign up, do use the code HOMIES, which will give me a tiny little kickback, which will help me to pay for the running of this podcast. He is also the author of Rapid Reference to the Fundamentals of Vitamin Therapy, Oral, Topical, and Intravenous Clinical Applications. He has been recognized, not surprisingly, as one of the top 100 most knowledgeable and skilled integrative and regenerative medicine medicine physicians in North America and the best-selling book Life Force by Tony Robbins et al. He has featured as an expert homeopathic physician in the groundbreaking documentary movie Introducing Homeopathy, released in 2024. Dr. Fleisher is the medical director of the Center for Integrative and Regenerative Medicine in the beautiful Blue Ridge Mountains in Afton, Virginia, and can be contacted at 434-361-1896. Dr. Fleisher may also be reached at his website, CIRM1.com, an international resource for integrative CAM, so complementary alternative medicine. He is also the medical director of Global Natural Health Solutions, GNShealing.com, an international worldwide resource for high-quality expert homeopathic and naturopathic online consultations. Holy moly, I think I need a bit of a breath after that. Now, I also, while you're listening, have a proposal. Now, as you know, Joe Rogan has got the top podcast in the world. So he is in the top 0.01% of all podcasts in the world. Basically, he is number one. My podcast is in the top 1%, just by the way. But we really need to get a homeopath on the Joe Rogan podcast. And out of more than almost 2,500 episodes, Joe Rogan has never had a homeopath on his podcast. So I vote that we all spam Joe Rogan on his social media and email and everywhere else that you can and tell him to get Dr. Mitch Fleisher on his show, because I think we'd be hard-pressed to find a better representative. I know there's incredible representatives of homeopathy around the world, but I really feel that Dr. Mitch is going to be an incredible representative for our profession. So let's all spam Joe Rogan and make sure that Dr. Mitch gets on his podcast so that millions of people around the world can hear about homeopathy. I'm just putting this in here as a side note. Do with that whatever you like, but that was just a brainwave that I had, and it'll be really fun if we manage to pull this off. Thank you for listening through this intro. I know you're going to enjoy the episode.
Welcome to the Homeopathy Hangout Podcast, where we discuss all things homeopathy from around the world. And now our mum and your host, Eugenie Kruger.
Hello, homies, and welcome back to Homeopathy Hangout, where today we have a very esteemed guest for you, Dr. Mitch Fleisher. Welcome to the show, Mitch. Now,
how you doing? Glad to be here.
Do you go by Mitch or Mitchell? I see you also go by Dr. M. Have you got a preference?
My patients all call me Dr. Mitch. So if that's what you want to say, that's fine with me.
We'll go with Dr. Mitch. Hey, you. So many of our listeners and those listening in on video as well will know you from the documentary Introducing Homeopathy. And there's some other spin-offs and things happening. I had a chat with Kim Alia the other day about, what is it called? Investigating Homeopathy as well.
Homeopathy. That's going to be very exciting.
Well,
I'm going to play some parts to play in that.
Yeah, I saw a bit of a trailer. I saw you on there. So I'm just so grateful that you've taken the time to have a chat with us today. Now, you might not know, but we have, in over the 400 episodes that's been running, we have a bit of a tradition on the podcast. And our guests have to tell us how they were first introduced to homeopathy. Can you tell us your origin story?
Oh, geez. Well, I have to tell you, I knew I wanted to be a doctor when I was about 4.5 years old. And, I grew up during that era of time, the human potential movement. So I was exposed through high school to ideas about traditional Chinese medicine, Ayurvedic medicine, naturopathy. I tried all different kinds of fasting programs and whatnot. So I was playing around with it a lot when I was in high school and in college. And I had determined that I wanted to go into some form of holistic medicine. When I got into medical school, I would just kind of hopefully keep my mouth shut so I could get through, because I tend to be outspoken in a way.
Oh, I know that feeling. Don't worry. I get in trouble all the time.
And so I had read John List's treatise on American herbal medicine when I was about 16 and a half actually. And I was excited about botanical medicine and naturopathic medicine. And then I read Felix Mann's treatise, like Yellow Emperor, which is one of the bases for traditional Chinese medicine. I started reading Ayurvedic texts. So I thought that when I went into medical school, I was going to do some sort of synthesis of Ayurvedic medicine, traditional Chinese medicine, naturopathic medicine, and do the whole 9 yards. And I started studying. In my first in my last year of college, I was learning Mandarin Chinese in order to be able to go to the Beijing National School of Chinese Medicine. And was able to start ordering dishes in Chinese restaurants, which got me a lot of peach liqueur. They like that kind of thing. So any case, but my first introduction to homeopathy was during this study cell that we created. A group of medical students and I, on the very first day of orientation at medical school, all got together. We felt like we were strangers in a strange land. Long-haired hippie freaks out here in Stanford, which was a bastion of conservatism at a different kind of conservatism back then. And we decided, I said, hi guys, so here we are in Palo Alto Menlo Park, the hotbed of holistic medicine in the United States. Why don't we create a study group and start bringing these people to speak? And so we started doing that. Commandeered Medical Student Association money, got an after-hours room, and videotaped them to lectures. And one of the students, who was actually a friend of mine who was a chiropractic student, not even in the school, he brought Dr. Bill Gray. And you know who Dr. Gray is?
Yeah.
That's before he was really rich and famous like he is now. Well, he's not rich. In any case, Bill was a graduate of Stanford, and we brought him to give us a lecture. And that was in December of 1975, in my first year. And his lecture completely blew my mind. I mean, here's this Western system of medicine where I didn't have to put needles in people, because I had gone to see Randy Neustaedter in Palo Alto, who was a great acupuncturist and was brilliant, but he made the mistake of putting these big honker acupuncture needles into the dorsum of my foot, the top of my foot. I hit the ceiling, and I said, how the heck am I going to do this to kids? Because I loved pediatrics. And I said, if this hurts me so much, I don't know if I could do that. So here was homeopathy, which nice little delicious sugar pills, and this comprehensive, logical, rational system of medicine. So I arranged, after that lecture, to do a preceptorship with Bill between my first and second year of medical school that whole summer. And I worked with him 6 days a week from 8 in the morning to 8 or later at night, just seeing patients all day long. And he was treating and curing people that I just learned in my first year of medical school were incurable, like steroid-dependent asthma, Huntington's chorea, severe ulcerative colitis, all these things. I was like, it was blowing my mind completely. In addition, he was, at the end of each day, he would sit me in his seat in his office, and the light would be pouring into the window and blinding me. So I was looking at a daze. And he would talk to me about spirituality, because he was into Bubba Free-John. And so I got both a homeopathic and a spiritual education at the same time, kind of spin my world around as a young man. And he gave me a copy of Berkey's Materia Medica and a little box of Remedies. And I was studying that and working with him on weekends. I would go up and see patients. And I was still really wanted to have a firsthand experience of homeopathy, but I didn't have an opportunity because I was so dang busy. And then I went with some friends down to Baja California, the very tip to La Paz. And we made the terrible mistake of eating fruit off a stand. And we got all three of us got rip-roaring cases of Turista, Escherichia toxigenic coli, and a rip-roaring diarrhea. And theirs got better. Mine continued. And everything I ate came out completely undigested. Lionteric stools, that's the name used in the repertorizing it. And I was getting more and more dehydrated and weaker, losing muscle mass and spaced out. And I went to the medical student clinic, and they, of course, you have a terrible bacterial infection. And they gave me this brand new drug called metronidazole flagyl. Didn't do a damn thing. So nothing that I did helped. No herbs, no vitamins, nothing helped. So one day, after I was so exhausted that I would go to my first class in the morning on embryology, and I would find myself falling asleep and drawing in my book in my lap. I said, this can't go on. So I go back to my little apartment that I was renting behind this big old house. And I was so tired that I decided I had to lay down. It was just the early afternoon. And normally I just, back in those days, I was a poor medical student. So all I was living on was brown rice and beans and maybe some broccoli for protein. But whenever I ate it, it would just go right through me. completely indigested. It was like, how could that happen? It blew my mind. So I came in and I decided I'll just lay down and take a little nap on my futon bed and laid on my bed. And when I wake up, I thought I slept about 5 or 10 minutes, but my clothes and the bed all around me were just soaked with sweat. And I said, how could that happen? I got a bit of a chill. And so I stood up and I said, I can't do this anymore. And I went over to my little cabinet where I have the homeopathic medicine kit. And I just opened up Berkey's, and the page that was there, I began to read. And the remedy that I was reading, it was like all my symptoms verbatim. And I said, I couldn't believe it. So I went into the remedy kit and I said, look, oh, and there it was. And I took that remedy and I laid back down and I fell asleep again. And I woke up and I thought I only slept for around 10 minutes and I sweat again. But when I got up this time, the first time I was lightheaded and dizzy when I stood up, and I was hungry. And the gassiness that I had, I felt bloated all the time, had gone away. I said, this is odd. So I went to the refrigerator and I had my big pot of rice and beans and I ate a whole bunch of it, like 3 bowls, more than I usually do. And I kept it down. I didn't have the rumbling and immediately have to go to the bathroom. I said, this is interesting. So I took a shower, got dressed, and went to go to my classes, only to find out it was the next day. I had slept a whole 24 hours, and it was the next day at the end of the day. And I said, oh my God, I couldn't believe that. And from that single dose of Cobba Vegetabilis 30C, I was completely cured. So I said, okay, I think I have to practice the system of medicine. And then I dedicated myself to it. And from that point on, I knew what I wanted to do with my career.
That's a really good origin story. Thanks for sharing that. Now, not just that, because I was looking at your sign off on your email, and it's like so many acronyms after your name. I don't think there's more acronyms after your name than more letters after your name than in your name. And you've done so many different therapies. And so to hear you speak about homeopathy like that is just so brilliant. I really love that. And that's why I said to you before we
homeopathy
started.
is really the foundation of what I do because it's the truly most holistic system of healing, addressing both the physical, emotional, mental, and spiritual on one continuum of energy. Because we're not just a sack of chemicals. We are spiritual beings having a human experience. So you have to look at the whole constitution to be able to help people. So I use that as my main bioenergetic approach, and then nutritionally support the body with diet and exercise and all the rest of it. All the things that Hahnemann talked about in the 4th aphorism. You remove obstruction to cure, which include, not eating right, eating processed crappy food. You stop eating that. You get the nutrients that you need. And since a lot of our foods are depleted of nutrients, that's the reasoning for taking different vitamins and nutrients. They just help you grow better. They're like superfoods. And then later on in my career, I added teaching my patients Tai Chi and Qigong, which I've been doing since I was 17. To loosen them up, I got into medicinal peptide therapy, there are remarkable substances. They are essentially peptides. The human body has over 7,000 of them, most famous of which is insulin, and also thyroid hormone is a peptide hormone, growth hormone is a peptide hormone, and they are essentially human communication molecules. So they work completely different than orthodox pharmaceutical drugs and from homeopathy in that they are it's one group of cells or organ tissues in the body telling another group what to do. So they're all communicating. So you have these wonderful substances that you can support healing with. I regularly treat my patients who have inflammatory bowel disease, Crohn's disease and ulcerative colitis with a homeopathic remedy, with prebiotics and probiotics and detoxification, and with certain peptides that help inflammation and regeneration of the gut. And they do phenomenally well. Rather than bleeding for weeks and months on end, waiting for the remedy to work. For example, I had a gentleman who's from New England who was having up to 40 bloody stools a day, and he was wasting away. I gave him his homeopathic remedy. He needed lycopodium, and I put him on something called peptides, which is BPC 157 body protection compound, which is a pentadecapeptide, 15 amino acid peptide produced in your stomach lining, which is intended for healing anything from the mouth to the anus, everything in between. That with something called KPV, an anti-inflammatory peptide, And within 4 days, he was having completely normal stools and was able to keep food down. And now, several years later, he's completely healed. And this is a young man. Well, he was in his 30s. The doctors told he had failed prednisone, had failed Humira, and all these biologic drugs. They told him the only thing they could do with him was to cut out his entire colon, the small and large intestine. So I said, how are you supposed to live with no intestines? It made no sense whatsoever. But he didn't need that, and is doing fine now. So
Yeah.
using all this integrated approach,
Yeah.
I find to be the most effective way to help my patients.
How are you doing this peptide therapy? Is it something that you're injecting or?
It comes in different forms. You have peptides that are topical, that are creams or lotions or sprays. You have ones that are oral. You have ones that are drops that you can put in your eye. And you have injectables, subcutaneous injectables. So depending on what a patient needs, there's different routes of administration.
Mm, that's
Fortunately for this, that just using the oral form was fine.
amazing. Did I hear you speak about using homeopathics as injectables as well? Do you do that?
Yeah, I developed this technique for joint regeneration based on my own personal experience with problems with my left knee. I called it JRT, or Joint Regeneration Therapy. And I had, back in the late 1990s, gone on a rafting trip with some other doctor friends in the Grand Canyon for 3 weeks. And we'd raft down the river and then spend the night. The next day, we'd get up and hike into the crevices in the Grand Canyon. Some of them were 15 to 20 miles deep. And it was all shale, this stuff, you're grinding, like almost walking on sand on a hill. So you'd take one step forward, 3 steps back. And it was 110 degrees or hotter in the shade. So you're wearing sandals and a wet T-shirt, if you could put it in stand the cold from the river. And so after 3 weeks of doing this, my left knee started grinding a lot. And I came back home and it was snapping and cracking. And one day I stood up from my desk and it popped so loud it hurt me in the back of my head. I said, this is not good. So I got x-rays and a CT and MRI scan. And sure enough, I completely split the medial meniscus of the knee. And if you look down on the knee, it looks like a horseshoe. And I split the inner part of it right down. It was flapping in the wind catching. So I went to the top sports orthopedics at University of Virginia, and they said, oh, we have to take this out, do arthroscopic surgery and resect the entire medial meniscus. I said, wait a second. You're going to cut out the entire meniscus on one side of my knee, then my knee's going to bend in, and isn't that going to promote degeneration? They say, yeah, you'll probably need a knee replacement in 3 years. I said, I'm only 49 years old. Are you kidding me? I know that those things only work in about 40% of people, and they only last for 3 to 5 years. Would be submitting me to a situation that would not be amenable to long-term survival of my knee. So I said, forget that. And I started investigating and learned about prolotherapy, proliferative therapy or reconstructive therapy. And that was developed by orthopedic physicians or physiatrists. And they would inject medicines in the knee that would cause it to be inflamed to regenerate the tissues by stimulating the regenerative process. You go from acute inflammation to chronic regeneration. The problem is that whenever I iatrogenically do something, doctor caused something, it never works out. It's always worse than Mother Nature would do. And sure enough, when I got the first shot, my knee blew up 3 times normal and hurt like heck. Worse than heck. I said, there's got to be a better way to do this. So I did research into, okay, what is it that regenerates the tissues? And I found there were homeopathic remedies made by pharmacies in Germany that were used for regenerating cartilage and tissues and all the rest of that, to BHI heal. So I bought some of those and shipped them in. I did research into what are the vitamins and nutrients that the cells that make cartilage, chondroblasts and chondrocytes, what do they need to regrow the cells? And then I looked into what is it that grows cartilage and bone and all this when you're a kid? And it's somatotrophin, human growth hormone. And at that time, that's when they were coming out with recombinant DNA, human growth hormone. So I bought some. I combined all of those together. I said, let me try this. So I shot it into my own knee. I know the technique. And I gave myself an injection every 6 weeks, 4 times. After the first injection, the pain and clicking completely went away. I said, well, this is cool. And after the end of the treatment, what I considered probably long enough for the cartilage, when it's produced, is gel-like, but it takes a couple of weeks to solidify to be solid. So then I repeated the MRIs and CT scans, and sure enough, the meniscus had completely sealed. It was back together, and my knee was healed. And I said, well, this is not something they taught me in medical school or residency. This is cool. So I went back to the orthopedist and showed him what he looked at the films and says, oh my God, that's really cool. What'd you do? I told him, and I said, you want to learn how to do it? He says, no, I'm a surgeon, can't do it here.
I know.
I
Isn't
said,
it
fine.
amazing how they do that?
So
Like you go back to your doctor and you say, I fixed this thing. Do you know want to know how I did it? And they just have no interest.
he couldn't wrap his mind around homeopathy. So in any case, I then started sharing it with my patients. I had this one patient who came to see me who had, she was retiring and wanted to go cross country with her husband and on an RV and hike all the mountains of America, like in Montana and all these places. And she started practicing it in the flatlands of Virginia, and her knee started bothering her a lot. And she got diagnosed with severe arthritis and was told by the orthopedic surgeon that she needed bilateral knee replacements. And of course, she was intelligent enough to ask, well, how soon after the procedures will I be able to go hiking with my husband? He said, probably never. And she didn't take that too kindly. So she said, forget that. And one of her friends was one of my patients. So she came to see me after hearing her story. I said, this is what I did to myself. Would you be interested? And she said, absolutely. So I gave her the injections. And after the first treatment, her pains went away. And I treated her for several months. And then she disappeared and came back almost a year later, showing me the brand new, beautiful RV she and her husband had bought, and showing me pictures of all the different places they'd been hiking. And she comes back every couple of years for a repeat. And since that time, I've treated dozens and dozens of patients with what I call JRT and had phenomenal results. And they've been nice enough to put video testimonials on my websites. And I had a lot of doctors say, we'd like to learn what you do. So I created a course that I call the JRT Masterclass. And I can send you that information for any docs who want to learn how to do that. And I put a lot of time, energy, and money into designing a class that really taught docs the science behind this, how it all works, and then videos of how you give injections without needing x-rays and all the rest of it. So it's really complete training. It's like a postgraduate residency training, and you're good to go.
You sound like a real life Hahnemann, like testing this out on yourself and then, sharing this information with others. I love that. So this is different to stem cell therapy, because I know of somebody who's, my dentist he used to get these injections with stem cells and they spin them or something and then inject them into your knee.
I tried stem cells for a while. The thing of it is with stem cells is they're very fragile. They're large, fragile cells. Stem cells are the regenerative cells in your body. You're born with a whole bunch of them, but they're as old as you are. And by the time you get arthritis in your 50s and 60s, and older, the stem cells are not as vital as they are when you're younger. That's why they use umbilical cord and placental stem cells, because they're brand new. The thing of it is that I found that in using stem cells, they send you frozen vials of about maybe 10 or so million cells. And then regardless how carefully you defrost them, you lose about 10 or 20%. And then when you inject them into the joint or to the body, they have to be alive. Because what happens is this, contrary to popular belief, the stem cells don't turn into new joint tissue. That's not what happens. They actually migrate to the inflamed tissue and they bind to the blood vessels. And immediately when they bind, they go into what's called an paracrine function. The paracrine function is that they begin to manufacture concentrated peptides that are anti-inflammatory regenerative. And they pinch off a piece of the cell membrane and they create a little packet of them. And these packets are called outside body. So what exosome means. And they're super concentrated doses of regenerative anti-inflammatory peptides. And then they push it out of the cell, and that migrates through immunological action to the inflamed tissues that binds it, and it dumps all these peptides into the cell, and that's what stimulates regeneration. So that's how stem cells actually work. What's nice about the exosomes is that they're not really alive. They're just packets of peptides. And there's a couple of different companies. The best is a company in Florida. This brilliant doctor researcher found out how to tickle stem cells to make them produce these exosomes, and then they would extract them and purify them and concentrate them so that you can then have them to inject into people's bodies. So I use them when regular JRT with homeopathic remedies and the vitamins, nutrients, and the peptides by themselves don't work. If someone's got a lot of degeneration, then I'll add in both the exosome therapy and sometimes even ozone therapy if people have had chronic infections. And so I use a multifactorial approach to each individual based on what they need to regenerate their tissues. And I've had some really good results with knees and hips and shoulders and wrists and elbows and whatnot, and neck and the back. It's pretty cool.
That's incredible. Something I was listening to you speak on somebody else's podcast, and you were talking also about, anti-inflammatories and how they actually cause joint degeneration. I had Ron Whitmont on recently who also spoke about that. And I feel it's something that we can't talk enough about because in Australia, certainly, non-steroidal anti-inflammatories are handed out like lollies, left, right, and center. I have a friend at the moment who's going through this experience where all the doctors giving her, and she's not that naturally minded, so and she definitely doesn't listen to this podcast. So, it's really sad because I can see the direction that it's going to go. But even my little somebody I know, what are they, 10, 11 years old, they just sprained their neck the other day, and they went to the doctor, and the doctor gave them like a Voltaren gel, so anti-inflammatory gel to use like topically. I don't know if that's quite as bad as taking it internally, but still, it's not letting the body do its own.
Voltaren?
Voltaren.
Yeah,
Yeah,
that's close.
Topical. So, she's only like 10, 11 years old. And for a neck sprain, instead of, I would have given Rustox, but it's not my child, so I couldn't do that. For a neck sprain,
actually,
a doctor
what I
prescribed
find-
Voltaren.
What I find works really fine the problem with really strong non-steroidal anti-inflammatory drugs like Voltaren or diclofenac, if the gel, it'll get into the tissues. The problem is once it touches the fibrous tissues, it will injure the fibroblasts. And if it enters into the cartilage, the non-steroidals, they will decrease inflammation in the acute phase, but they actually harm the very cells that create soft tissue and cartilage and can further degeneration. It's not as bad as taking that by mouth, taking Voltaren orally or ibuprofen or ketoprofen, any of those long term. That's definitely going to actually promote arthritic degeneration, almost as bad as in taking steroids when you take it long term. But it damages the lining of the stomach and the gut. It can hurt the kidneys. So there are a lot of side effects. For a sprained neck, what I find works extremely well is alternating hot and cold compresses and using a magnesium oil. And Tramiel. You know what Tramiel is, right?
Yeah.
Yeah, I have them heat up the neck with a moist compress to increase blood flow and lymphatic flow. Then rub in the Tramiel, which is I'm actually a brilliant combination. And that Reykjavik, Hans Hagberg Reykjavik discovered Tramiel.
Oh no, I don't know. That tells the story.
Yeah. Hans Hagberg Reykjavik was an allopathic doctor who was kind of getting into homeopathy, and he visited Hahnemann's tomb in Paris, and he was sat there and took a nap, and he fell asleep at the tomb, and he woke up and he had a dream. He said that Hahnemann gave him the formulation for Tramiel, which he then created a company out of it, and it was the most effective of all those formulations. Which is kind of amazing.
I have never heard that story. I love it.
It's true. It's really amazing. A lot of the other stuff he did was not so cool, but because it's not really homeopathy, it's homotoxicology.
Mm-hmm.
Yeah, combination remedies. But I find using Tramiel with the moist heat and the magnesium oil is tremendous for eliminating all kinds of muscle strains and sprains and musculoskeletal injuries without taking drugs internally.
Is this, because I want to come back to that, but I just want to also check, is this one of the protocols that you have in your DrMCare?
It is.
It is. Oh, good. We'll definitely talk about that.
I have a protocol that's called arthritis and musculoskeletal trauma. And I list all the supplements that would be helpful and some homeopathic remedies. And also I have a section, it's called additional supportive care, and it teaches you how to do these things.
Amazing. For our listeners, I want you to remember what we just said because we're going to come back to it because I just really want to finish off, just really kind of bring it home about this anti-inflammatories and how the reckless use of it really is causing so much harm, because I see in so many mothers groups over here in Australia, they recommend ibuprofen for teething pain. And so you have these babies that are constantly getting ibuprofen for teething pain. I mean, what sort of long-term, what would you expect to see long-term, or what sort of advice can you give these mums that are doing this or being told by their doctor that it's safe and effective?
Well, a baby, a neonate like that, their cartilage and bones are just growing. And when you introduce, it depends on how often you use ibuprofen, but nonsteroidals like that can be injurious to their GI tract, their intestine and their stomach. It actually decreases the mucus lining of the stomach, so it makes them more likely to have problems with GERD, esophageal reflux disease. It can hurt their developing kidneys because the kidneys are very sensitive to the nonsteroidals. And it also can injure their cartilage and soft tissue. So you'd like to use other approaches that are much safer, like depending on if they're having problems with teething, chamomilla. I mean, there's all different kinds of simple remedies. Using even a very safe naturopathic thing is to get clove oil. Clove oil, just damping it numbs up the mucous membranes of the gums, and that can help take away pain. Also, there's a Polynesian herb called kava kava, Piper methysticum, and you can get it in gel caps, the concentrated gel. And I get the gel caps and you just poke a little hole in it, squeeze it onto your finger or onto a Q-tip, and rub that on the gums. And it is amazing for numbing up the gingiva and take away toothache pain. So there's many natural things you can do so that you don't have to potentially injure your developing child.
You've just given me flashbacks to my early 20s having a kava ceremony in Fiji. It was really fun.
So did I.
Did you? Oh,
I did that too. Oh,
everything goes
That was
numb.
an amazing experience. How your mouth goes numb and you get silly and what? That was a lot of fun.
It was a lot of fun. Anyway, where were we? So okay, let's basically try and find some safer alternatives because there is a price to pay for these things. And, you telling us that cartilage can, heal and rebuild itself. It's just so absolutely incredible. But also I'm just like, how are we going to find practitioners over here that does that? I mean, because you need to physically go to somebody and, have them do this protocol.
You could have them, if there's enough people that want this therapy, that might encourage the practitioner to learn how to do it. And he can take my JRT masterclass course and learn how to do it. He can actually send me emails and questions and I can help them through it. I love teaching people other doctors how to do this kind of thing. I teach homeopathy, I teach peptide therapy, all of this stuff, because I want other doctors to be able to offer it to others. I can't do it all myself.
Yeah, well, exactly right. That's what I'm just thinking is there's all these people that are going to be listening to this that are going to want this because it sounds like an incredible, safe alternative. And it sounds like it's a bit cheaper to do than stem cell therapy as well, from what I heard you mention.
Yeah, definitely.
Amazing.
Because again, as I mentioned earlier, all true healing is self-healing. And the more tools you have in your armamentarium to be able to help yourself and keep yourself out of the ER or necessary hospitalizations, the better. It's much more cost-effective, holistic, natural approaches to healing.
So there's so many different things we can ask you because there's so many modalities to draw on and you've got such an incredible history. I'm going to read out your bio when I record the intro later on because it's so long and you've done so many things, but I want to make sure that I read it all out. So that's going to be a separate recording. Okay. But I want to check with you. Whenever I have guests like you on the podcast, I know that we can go in any direction, but what are you most excited about at the moment in the world of homeopathy or whatever work that you're doing? Like, have you got some things on the horizon that you're working on, but what's really getting you excited at the moment in your work?
Well, I'm really excited. Kim and I are, working together on, global natural health solutions, which is our intention to be able to make homeopathy really high quality homeopathy available to people all over the world, particularly throughout North America and then the rest of the world who don't have ready access to homeopaths. Because there's not a lot of this really, and not a lot in America. It's a whole lot more in India than right here. So we created GNHS to be able to offer not only homeopathy, but I've been teaching the doctors who are working with us how to use nutraceuticals, how to use peptides, how I've integrated everything together. And we offer naturopathic testing approaches so we can make proper diagnoses. And I'm serving as the medical director of Global Natural Health Solutions. So I supervise all the other doctors that are working with us. And we're growing. We've just been around for a little while now, but we're growing as people discover who we are and what we're doing and the good work that we're doing. So that's really one of my dreams, to be able to make sure that homeopathy survives into the future. And that's my contribution. And also I'm really excited about what introducing homeopathy and investigating homeopathy are going to create. Because I'm hoping that's going to reach Bobby Kennedy and Trump all the rest of them, and they're going to make it part of our healthcare system.
There's just the flu isode, like having the flu in potency, the flu vaccine in potency. He needs to take that through all the...
I think that everyone should know about oscillococcinum.
Yeah, but for him specifically, because he said that he took the flu vaccine for years and it is a known side effect of the flu vaccine. So, Bobby, if you're listening, you need to take the flu vaccine in ascending homeopathic potencies and causticum.
That's possible, but we don't know. We don't know whether it was really the flu that he got. It could have been a wide range of different viruses. Well,
he said that. So I've heard him say that he got the annual flu vaccine every year, and then he was suing he was doing like a case of people who were suing the company because of injuries from the flu vaccine, and then he read through the side effects of the flu vaccine, and one of them was this dystonia that he's got.
Right.
So the etiology is the flu vaccine. He needs to take that in potency.
well, we don't know that because that's more of a allopathic approach to homeopathy. In reality, we want to take his whole case because what are the number one remedies from ailments from vaccination? Generalized ailments from vaccination, thuja, sulfur, silica, whatnot. We'd see what symptoms did he have at the time, and also causticum is in that rubric. So it could be one of those.
Definitely, so causticum is not even funny.
So if we take a complete case, we're more likely to come up with the true remedy he needs to eliminate his vaccinosis.
I agree. I've just also had good results with actually giving vaccine and potency. I know you do a little bit more classical, but I think
I treat a lot of autistic. I cut my teeth through treating a lot of autism. And I actually gave homeopathic MMR and homeopathic DPT and had some tremendous results. I would do that first in ascending potency and then would give them their constitutional. And I had quite a few young kids recover from autism.
I've just recently interviewed a really interesting guest whose daughter has been mostly recovered from autism, and he worked with a homeopath in America called Deborah Olenev. And what they've done is instead of giving the vaccine remedy in potency because the child was having such big aggravations, while she's an adult now, she's 32, they would just leave the remedy in the room and then kind of move it closer to her bed as she got better and better and put it under her pillow or make her carry it because she could never actually take it because she would react too badly. So I thought that was interesting as well. Yeah.
There's a lot of different ways to skin a cat.
Yeah, well, this is a theme I feel with the podcast. When you get homeopaths together,
I wouldn't skin a cat, though. That would be awful.
Well, I mean, we don't know each other from whatever, from anything. And we can always find something to talk about with homeopathy. I feel it's just so vast and it can come from so many different angles. What else well, actually, just GNHS. I haven't heard of it. So can you tell us just like a little bit more and who is it for and where people can find information on it?
Sure. Well, we have the website is www.gnhshealing.com. And Kim and I and a few other people got together and we created it. We originated several years ago. We've been it took time to build out the website because we actually have a HIPAA compliant. I don't know if you know what that is, HIPAA. Mm-hmm. In the United States, you have to legally protect someone's healthcare information, their privacy. So we have it on a platform that's HIPAA compliant. So when we take a case, it's recorded. So we have a audio-video recording of the consultation that we can refer back to, but it's protected information, and we can send private, secure messages to and from the practitioner to the patient and back and forth. Then as the medical director, we can have group meetings. I can consult with the practitioner about the case and review it, the history, written history, and review the videos to see if there's anything else that needs to be explored. So it's a very sophisticated platform where we provide really complete homeopathic natural medical care to our clientele, our patients. It's pretty cool.
Yeah. Is this the one where I know Kim is doing a series where you can watch live cases being taken and then the practitioners talk through the remedies that they gave? Or maybe this is something different that he's doing.
Well, the cases are taken privately between the practitioner and their client, their patient. And then it's recorded. And if we, within the context of the medical practitioners, with the permission of the patient, I'll review it and give suggestions about what else can be done to help them if necessary. But we have ongoing training in the portal too. We meet every week or every other week to review cases, to discuss materia medica, to bring up new topics in naturopathic and homeopathic healing. So it's ongoing, continuing medical education.
Okay, amazing. I think that's, I'm just trying to figure out because I remember Kim mentioning about this as well. I wonder if that's different to what he has on Whole Health now.
The other thing we have on Whole Health now, the GNHS is mostly for constitutional chronic prescribing.
Hmm.
And we created something else called homeopathic house call, which is more for acute prescribing.
Okay.
And when someone gets a membership in GNHS, you actually get a membership to homeopathic house call for acute remedies, because it puts through this very interesting protocol that it asks you questions that you fill in, and that helps it analyzes the acute symptoms and makes remedy recommendations, and it's really pretty interesting.
Oh, amazing.
And also, you also get access to alternative.drmcare.com and all the naturopathic and nutritional information there.
Well, that was a great segue because that was going to be my next question. So tell us about what is Alternative Dr. M Care?
Well, the alternative care came out of my early practice when I would treat people with nutritional regimens and they would get better. They would say, "Oh, I have an Uncle Joe in Montana or Aunt Jean over here," and they would all want that information. And I wanted to be able to, give it to them in a way in which they could understand it and digest it, and to be able to ask questions. So initially, I was writing a book that had all my protocols in it at the time. But what happened is that every 3 or 4 months or so, the names of supplements would change, or they would add new ingredients, or new science would develop, and I want to add that. So I'd have to write a new book every 3 or 4 times a year. And I said, this is ridiculous. So a friend of mine is a webmaster, and he said, well, we'll create an online ebook, just kind of a backdoor to go in there and you can update things. So that's exactly what we did. And we kept on making new iterations of the platform as the technology expanded. And now it's a really beautiful, dynamic website. And well, there she is.
Yeah,
And
just for those watching on the video, I'll just scroll
yeah,
through the site so you can see.
yeah. And basically, I have over 220 different protocols there, and they get 24/7 worldwide access to a lot of all that information. And they can actually, once they're a member, they can send emails to me and I can answer their questions and let them know if they need more in-depth treatment of a sort and give them referrals. So it's really a pretty complete self-healing platform. It's giving people the tools they need to be able to help themselves with a wide range of diagnoses or health conditions. Give them more hope that they can help themselves.
I'm just looking
And
here at like protocols for ADD. I mean, that is huge at the moment. It certainly seems to be the buzzword.
yeah.
And glaucoma. I mean, that can be really hard to treat. So if you can get a
Well,
protocol.
I found things over the years of ever decades of trying different approaches. What I've done is I've distilled the protocols down to the most effective supplements, nutritional supplements. And, I explain the name of the supplement, how much is the effective dose to take, what it's made of, and how it works. So you're getting a little mini education of how these things work. And at the end, I have a little part that says Dr. M recommends. So I tell you which ones are the good ones to start with.
Mm.
And you can add from there depending on your own unique experience. And then I add in additional supportive care, the different naturopathic approaches that people can use to help themselves. And I have a whole section on the resources of where they can order these things directly themselves online.
Amazing. I'm just actually scrolling through your cold and flu protocol
Hmm.
here, which is, I mean, I don't think there's anything that you've missed. Like, you've got everything in here. Holy moly. And you
Oh,
give
it's
the
a lot of
guy,
information. Yeah.
it's a lot.
If you printed this out, it would be about, 10 to 12 pages.
That's incredible. I mean, it does make sense to rather have it on the website here rather than as a book.
Yeah. I
Like
mean,
you
it's
say,
just,
like with the names
when there's
changed. Nothing more frustrating than
all the
having a book that's
time.
a
It
couple
happens
years old
all the time. It
and
drives me
the names
crazy.
change and it's like, well, now this book is useless because I can't use that product anymore. So it
Exactly.
makes a lot more sense having it on the website and you can just, quick and
Yeah, and so
easy edit it.
basically, when you have a membership, all the updates that I put in it are all for free. It's just a
Mm.
one-time membership, and then you get all those worldwide consultations
Oh, that's
24/7.
amazing. So it's not like a monthly thing that you keep paying. It's like a once off.
Look, my webmaster recommended we do both an annual fee and then a one-time lifetime fee. And then he said some people just like to pay month to month. So we offer all those different options.
Okay, gotcha.
Whatever works for you.
Yeah. That's amazing. Great. Thank you for sharing that. I mean, I have a lot of gratitude for people with such a vast and long history as yourself that actually take the time to then educate the rest of us and share what you've learned because, it's so much harder if we have to all start from scratch. But if we can just kind of, stand on the shoulders of giants who've done the work and we can build from there, it really is wonderful. And
Well,
especially
I've learned from giants too.
Yeah.
And I've distilled what I've learned over the last 45 years into information that I think will be helpful to a wide range of conditions that really help people heal themselves. I really believe that, again, all true healing is self-healing, and I love to empower my patients and my families with tools that they can help themselves, and they don't have to rely on me 24/7 because I want just one person.
Yeah, that's exactly right.
I want to teach them what you can do to handle most the modern, usual everyday acute conditions. And you don't have to immediately run off to an ER and spend hundreds of thousands of dollars unnecessarily.
Mm.
And and when people are empowered like that, and they have the direct experience of, yeah, I can take care of myself and my family just fine. It's very gratifying. It makes me very happy.
I was having a chat with a friend of mine who's a marketing lady, and I was saying to her, I'm thinking of like rebranding like a little bit, and she said, it's so important that your ethos of what you're all about really is the essence of that. And I said to her, if you were to wake me up 2, 3 a.m. in the morning and ask me what is my goal, it's empowering mothers. Like that's for me, like that's what everything comes down to at the end of the day, because I know what it was like when I was a new mum with a newborn. Luckily I had discovered homeopathy beforehand. I was starting to study homeopathy before I got pregnant. But the power and confidence in my parenting and looking after my child, what that gave me is priceless, and nobody can take that away from me. And if we can empower more mothers in that way, where they were like, hang on, my body can heal itself, my child's body can heal itself, I know what I'm doing, and not be pushed over and forced to do things that they don't want to do. I just think overall it will benefit the planet so much, because when we have, I see these mums, and I know you see them too, that are so highly anxious. The tiniest little thing that their child has, they run to the doctor for. And it breaks my heart because that your child is so linked with you. They feel everything that you feel. And if you're in this constant anxious state, that child is feeling that. But if you are empowered and you know how to heal your family, like, we've always been our own healers. And if we take that back, I just think that makes us so powerful. And when things like COVID happens, we're not going to get pushed around as easily because we're like, hey, our bodies can fight this stuff. We've got an immune system.
Yeah.
So there's real power in learning how to treat your own family. And that's why I'm really grateful for these protocols of yours, because if you are, anxious or you don't know how to empower yourself, go and get these protocols. Then you have got, instead of running to the ER, you've got these protocols that you can do. And look, the ER is always going to be there. If you've done the protocols and they haven't worked and all the natural things you've tried hasn't worked, go to your doctor. That's what they're there for. But as a first line, that we take back our power to be able to heal ourselves and our own families, I think is the most powerful
With that
thing.
in mind, I actually have a lot of pediatric protocols in there for
Oh, amazing.
ear
Oh,
infections and,
great.
split lips and head trauma and all that.
Oh,
It
amazing.
happens to kids. I have protocols for what are the good nutrients to give a child at different age groups. I have a really good anxiety and stress protocol for moms. So there's a lot in there that can help families out, make it a lot easier to live in
Yeah.
this planet, this crazy world we're in.
Amazing. Anything else? Like while you're on the roll there, can you remember some more off the top of your head?
Everything, acne, everything from acne vulgaris to cancer. I have protocols
Oh,
for
wow.
growth sensation, protocols for arthritis and bursitis and ligamentitis, and protocols for all kinds of gastrointestinal problems, for peptic ulcers,
Wow.
gastroesophageal reflux disease, for ADD, ADHD, autism. I just
Okay, so pretty much everything.
every
Okay,
Well,
good.
I'm a family physician,
Mm,
so I recognize I treat all kinds of things and all kinds of people. So I basically wanted to address what are all the most important issues that people want. So I have every imaginable acute condition, and then a lot of the chronic conditions that people
mm,
have to be able to mitigate it. So they give them some tools to use so they don't have to resort to potentially toxic pharmaceutical drugs.
mm.
It gives them an alternative.
Have you got something
And
for asthma in
people
there?
are able to wean off a lot of those drugs and just use the supplements instead, which is also nice.
Mm. Anything for asthma in there?
Oh, yeah, I have a whole
Is that
asthma protocol.
amazing?
I
Oh,
have a protocol for chronic obstructive pulmonary disease, for pleurisy,
mm,
for chronic lung disease. I have a COVID protocol too for people who actually really have it. I have an influenza protocol. You name it, it's probably in there. And also, if someone has some really strange condition, like I had a patient come to me a number of years ago with this very rare disease called
mm,
porphyria, in which they have a genetic abnormality that creates a lot of pain in their system because their body can't get rid of these end products of metabolism called porphyrins, and it creates a lot of pain, incredible spasms, pains. And in treating these patients, I found out what are the agents that you can take that help promote healing. And so I have a whole protocol for that. So if patients come to me and say, "Well, I don't see a protocol for me out of year 220. Here's my condition." I will create a protocol for them and then load it up to the website so that other
oh,
people with that
no.
condition can use it.
Okay. Huge one, constipation. Have you got a
Oh,
protocol in there?
yeah.
Okay, good. Because seriously though, how
Dysentery,
many people
constipation,
suffer with
diarrhea.
constipation?
Yeah, yeah.
Any
Well,
pregnancy stuff in there?
constipation, acute is fairly easy to deal with.
Mm,
You just got to know the right nutrients to use that works extremely well. Like I find one of the ones that works phenomenally well is organic chia seeds, organic flax seeds,
mm.
and I put that in a nice herbal tea and chug it down, and that will make most people poop. If people have problems that those acute remedies, so simple nutritional approaches don't help, that's where homeopathy works phenomenally well. You find out what is this person is a calcareous salt and needs silica. I mean, all the different remedies the rubric for constipation has hundreds of remedies in it.
Hundreds, yeah.
So you got to take a whole case for chronic constipation. But I've
Mm.
had tremendous results. You know what the most phenomenal remedies for constipation is?
Tell me.
For people who tend to be these unbelievable caretakers, they got to take care of everybody and everything except for themselves. Carcinosinum. You know that remedy, right?
Oh, yeah, of course. Yeah.
That is one of the biggest remedies for constipation
Okay.
in women who are excessive caretakers.
Hmm.
Now, I wouldn't go out and run out and take it.
No, no, no.
It has to fit your case.
Yeah, absolutely. Also pregnancy. Have you got any protocols or any advice for pregnancy in there?
Yeah, I have a whole section on things
Amazing.
to do during pregnancy and what to do for labor and delivery. Yeah, that information's in there.
That's amazing. I'm so glad it's not in a book. It's going to be so much easier going control F or like doing the search function and finding what you need and then just getting it out of that.
And if people, once people have a membership, they can also send me an email. I answer their questions.
Wow. That is incredibly valuable. Thank you so much for that. So I have
You're
got that
welcome.
website up here, alternative drmcare.com. So just hop on there. And you do have a different website as well, but I went to click the CIRM1.com, but it,
Yeah, that's my office website. It
okay.
stands for Center for Integrative and Regenerative Medicine,
Okay.
CRM.
Has it got a one at the end and then .com?
Yes, one,
Oh, okay.
because when I originally what got the URL, there's another company out in California that does something completely different
Okay.
than homeopathy that already have CIRM. So I put CRM1.org.
One. First
Yeah.
one to go to. Dr. Mitch, thank you so much for your time today. I just want to check, is there any final thing? I mean, there's loads of things that we can still talk about. I'm sure we can talk for another 10 hours, but any final thing that you want to make sure that our listeners get out of today? Like any final message you want to leave them with or a final thing that you want them to consider or think about? What message
Sure.
would you want to leave them with?
Well, just understand that your body has an innate ability to heal itself. You just have to do those things that support it.
Mm,
You want the right diet, the right exercise, the right bioenergetic stimulation. I've been doing Tai Chi and Qigong since I was 17 years old. They're phenomenal for keeping you young.
mm.
And I'm a product of my own, taking homeopathy. I'm 72 and a half years old now.
Wow. Are you
I,
serious?
I'm serious.
Wow.
That blows people's minds
Yeah,
when
it does blow my mind. I was thinking maybe like late 50s, 60 maybe. That's
well,
incredible. Wow.
so I know for a fact that this kind of approach to healing works because I'm a good example of it. And I've gotten just incredible gratification of treating children and families. I cut my eye teeth as a homeopath years ago, treating young women with infertility. And now I'm treating their grandchildren.
Oh,
So that's real homeopathic family practice. I've seen the generations. And, I've also, it's understood now, and Hahnemann talked about it, and other homeopaths over the years have talked about it, that when you treat a generation, if you're able to treat up into the third generation homeopathically, you actually eliminate predispositions to disease. You nullify miasms.
yeah.
So you can actually eliminate inherited disorders. And I've seen some phenomenal things happen in people. So if you take this approach, this homeopathic holistic approach to healing, and really embrace it, you will do fantastic things for yourself and your future generations.
Wow. Aren't we lucky to practice this beautiful medicine? It's so great. And
We are.
how
It's a
incredible
blessing.
seeing the generations down the track. I mean, I've had the privilege of helping with infertility and then, seeing the kiddies grow up. But, some of them are like now, heading into teenagehood, but I haven't gone further than that. So I'm looking forward to hopefully treating them and their children one day. I think that must be the ultimate gift. And how
Well,
incredible
I
that there's.
would also ask if your listeners, your watchers, would also help support Global Natural Health Solutions. Let other people know about it. If they don't have anybody who doesn't have an access to a good homeopath, this is a way you can get it. And take advantage of alternative DrMCare and learn some powerful self-healing tools.
Amazing. It's all out there. Thank you so much, Dr. Mitch. I really appreciate your time. I know you're super busy, so I'm incredibly grateful for
My
this.
pleasure.